Diabetes is a chronic disease that affects millions of people around the world. It is a complex condition that requires careful management to avoid serious complications. In this article, we will provide an in-depth overview of diabetes, including its definition, types, causes, risk factors, and symptoms. Defining diabetes and its types. Diabetes is a metabolic disorder that affects the way the body processes blood glucose, also known as blood sugar. The hormone insulin, produced by the pancreas, helps regulate blood glucose levels by transporting glucose from the blood into the cells where it can be used for energy. In people with diabetes, this process does not work properly, leading to high blood glucose levels. There are three main types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes is an autoimmune disease in which the immune system attacks and destroys the cells in the pancreas that produce insulin. Type 2 diabetes is a progressive condition in which the body becomes resistant to insulin or the pancreas does not produce enough insulin to meet the body's needs. Gestational diabetes occurs during pregnancy and usually resolves after delivery. Causes and risk factors. The exact cause of type 1 diabetes is unknown, but it is believed to be related to genetic and environmental factors. Type 2 diabetes is associated with several risk factors, including obesity, physical inactivity, family history, age, and ethnicity. Gestational diabetes is caused by hormonal changes during pregnancy that can make the body less responsive to insulin. Other risk factors for diabetes include high blood pressure, high cholesterol, and smoking. Certain medical conditions, such as polycystic ovary syndrome and sleep apnea, can also increase the risk of developing diabetes. Symptoms to watch out for. The symptoms of diabetes can vary depending on the type and severity of the disease. Common symptoms of type 1 diabetes include increased thirst and hunger, frequent urination, fatigue, blurred vision, and unexplained weight loss. In contrast, symptoms of type 2 diabetes may develop slowly and be less noticeable, such as increased thirst and urination, fatigue, blurred vision, and slow healing of wounds. Gestational diabetes may not cause any symptoms, but women who have had it are at increased risk of developing type 2 diabetes later in life. It is important to seek medical attention if you experience any of these symptoms, as early diagnosis and treatment can help prevent serious complications. Conclusion. Diabetes is a serious and complex disease that requires careful management to prevent complications. By understanding the definition, types, causes, risk factors, and symptoms of diabetes, you can take steps to protect your health and well-being. If you are at risk for diabetes or have any concerns about your health, speak to your healthcare provider to learn more about screening and prevention strategies. With the right care and attention, people with diabetes can lead healthy, active lives. Diabetes is a chronic disease that affects millions of people around the world.